Welcome to another edition of Coffee and Tea with AARP Connecticut, which features AARP staff, volunteers, and decision makers from across our body of work. We discuss a variety of topics impacting older Connecticut residents and their families. I'm Nora Duncan. I'm the state director of AARP Connecticut, and today I welcome back Mairead Painter, the state's long-term care ombudsman. Mairead, why don't you tell us a little bit about what you, your staff, and your volunteers do?
Well, thank you, Nora. Thank you for having me on today. I'm Mairead Painter, the state long-term care ombudsman. Most people have never heard the word ombudsman, and they don't really understand it until they need one. Our role is to support individuals in long-term care settings. So that's nursing homes, residential care homes, and assisted living communities. When we talk about assisted living, we mean managed residential communities in their whole, all of them. So we work with them to make sure that residents understand their rights, that their rights are protected, and that they're receiving high quality care.
Great, thank you. So, it's been a long haul for nursing homes and assisted living residents, the staff, families. The pandemic has been hard on everybody, including you and your staff. So first, I want to say thank you to you and your staff for the tireless work that you have put in during this pandemic. Nearly 4,000 residents have passed away, and we are in a different place now than we were a year ago. But things are changing rapidly again. And I'm hoping today we can sort of chat about the state of the state for Connecticut's nursing homes and long-term care facilities. For a long time, all the policy decisions were being made at the executive and public health order level. Then there was a response. You played a big role in all of it. You and I and my team worked closely throughout the pandemic to try to make sure that even when there wasn't a legislative response, those executive and public health orders were going in a certain way. So maybe you can tell folks about visitation and isolation, how hard it was and where we are now and what people's rights are.
Absolutely. And things have changed a lot. And we've seen some improvements in the situation since March of 2020, when residents really lost the right to have autonomy and choice as to how they lived their life and who was participating in their life on a regular basis. Traditionally, residents in nursing homes have the right to have visitors of their choosing at any time. And due to a federal waiver of that right, that was drastically changed. And residents spent almost a year pretty much just in their room by themselves and getting care from staff. But that was really the only interaction that they had. And we know that there was a significant impact to the residents because of that. That isolation really caused individuals to have failure to thrive. We saw weight loss, loss of ability to maybe ambulate as much, use their body the way they used to, and even talk in some cases. So that was a dramatic change. And so we really, with AARP's help, we've really been as loud as we can in advocating for the whole person and social and emotional needs, that they should be treated equally to medical needs, and that you can't have one outweigh the other. And I think that's what we saw during the pandemic. So we are trying both at a state and federal level to see changes in that so that it'll never happen again. But in March we started to see a little bit of change over the summer. We had something called compassionate care visits, but those were really limited to end of life or in extreme circumstances. They were granted for very small periods of time. That was expanded a bit in the fall, but still not widely used, I would say, in all nursing homes. I think nursing homes were trying to follow the federal guidance. They were nervous about making errors. So we had to work with CMS, which is the Center for Medicare and Medicaid federally, that puts this guidance out and licenses the nursing homes, and was working with our local departments related to assisted living communities or memory care units. And so we eventually, just this spring, got new guidance related to visitation. And now our expectation would be that all nursing homes have reasonable access to visitation, and residents are able to see their loved ones, people of their choosing. I am a little bit concerned right now with the uptick in numbers, that as anytime there's a positive case in a nursing home, visitation is paused and they have to do testing and figure out the source. And so then you could see, 3-4 weeks of visitation on a unit paused or anyone impacted. And so it's really important. We've been advocating for vaccinations. It's important that people get those vaccinations, not only to help keep people from getting ill, but to keep people able to have that emotional connection. We did a lot of rollout regarding connection. You and I worked together, Nora, and AARP on getting iPads out to residential care homes to keep people virtually connected when they couldn't visit. And we did a huge push with our legislators to try to make sure that they heard the stories of the individuals that we serve. Our governor did call for an independent study of what had happened. We had the Mathematica report, which rolled into something called NALOG, the Nursing Home and Assisted Living Oversight Work Group. Tough name there. That one was always tough to pull off. But through NALOG, I was happy that we had the opportunity for our elected officials to hear directly from residents and family members about the impact of all of this to them. And because of that, we did have some movement forward related to legislation.
So, the amount of work that went into NALOG, which I never get right, no matter how many times I try, it is really incredible from you, from legislators, from policymakers, at the administration, family members who joined in. There was so much work and, adaptation and innovation and, of course, frustration. But in the end, we had a really successful legislative session on the response to this pandemic, including getting some things done that we've been working on other years that didn't get the proper attention they needed because, it's super unfortunate that sometimes the only way to get progress is for there to be a crisis, but that's kind of how humans and laws work sometimes. But, we've got a couple of, 3, 4 probably really good bills that passed. Do you want to give a synopsis? Maybe we'll talk through some of those.
I would love to. And I want to say, again, with the help with AARP, my office, our staff, the advocacy that was done, our e-board, the elected officials that we have really responded. And you're right, there are bills that we have tried to pass for years, but I think because of the light that was shown on these issues and concerns and having the ability to hear directly from the people that were affected, we were able to get those changes made. So why don't we look at some of the things that were moved forward? One was an act strengthening the voice of resident and family councils. This really requires input from residents and family councils on long-term care facility statewide policies that affect their lives, anything that's going to impact them, that they would have the ability to be heard directly on and to be heard in a way that accommodates their needs, whether it be virtually or over the phone. And we've not had that before. So that to me is huge. And I think that's going to have a major impact moving forward.
It's kind of one of those nothing about me without me scenarios that, you hear a lot in the disability community. And it's progress, again, that, we're getting people the opportunity to speak up for themselves. It's so important to remember that because someone's in an assisted living or a facility or a nursing home does not mean they have lost the ability to advocate for themselves. And sometimes the only reason they don't have the ability is because we haven't provided creative ways to give them that opportunity. So I'm excited about that legislation.
Absolutely. And one of the things we heard repeatedly throughout the pandemic was that residents felt this was done, a lot of things were being done to them, for them, but not with them. And so that, I think, speaks to exactly what you said, and people want to have a say when it impacts their lives, and they have the ability to. I think many people have an image in their head of a nursing home resident, but I would challenge anyone to go to a nursing home and say that every person met that stereotype. We have people that are very articulate, able to express how they feel, what their desires are, no matter what their age is. And we shouldn't just be putting people into boxes. We should be really listening to them and hearing about how the changes we're proposing might impact them.
Yeah. Then we've got an act strengthening the Bill of Rights for long-term care facility residents. You want to talk about that?
This one's huge for me. So this is something that kind of grew from a bill I know we had worked on in the past together and continued to work on. And it started as sort of a camera bill, right? That was sort of the bills in the past. But when we talked to residents, when we talked to other people, we really saw a need for a technology bill, right? Ability for a resident to use the technology of their choosing. Why should you or I determine what technology is appropriate for a nursing home? And technology changes, who knows what they'll have in a year or even two from now. We don't want to be passing bills every year to accommodate technology. So this bill allows residents to use the technology of their choosing and to pay for it to be installed or have it in their room. The nursing home is responsible for having internet access and the power to drive those devices, but the resident can have them. They can use them for connectivity for visitation, for security, just like you or I get to use in our home. It's the nursing home, that's their room, that's their home. And so they have the right to use that now, as well as I'm going to be starting a podcast that'll be available for them to just ask about their rights, and they can do that right from their room from those small listening devices. So really looking at how we get access to information for people, no matter their setting or the way that they need to have it brought to them.
Some of the technology that we're talking about is so inexpensive now too, that, even with some of the, like, we got a little bit extra into people's pockets moving forward for what they can keep if they're on Medicaid for their personal spending. Some of those technologies could be afforded with that. But lots of people have family and loved ones who are excited about the ability to, see people face to face, right? I mean, that was part of the social isolation issue, is that you couldn't see your loved ones, you couldn't see your grandchildren, you couldn't see anyone. And this is, I think, outside of a pandemic, you talk about, I have rights within my house. Why shouldn't a nursing home resident have rights within their house? But it's really great for caregivers who are far away too. I mean, there's people who just can't see their loved ones in person because they live on the other side of the country. And this is just going to bridge a gap that has been there for so many people. Lots of nursing homes and assisted living facilities didn't restrict their residents, and some allowed these, but some were forbidding it, and that is no longer going to be allowed. And we should state also that there's lots of privacy built into the law, lots of consulting with your roommate if you have one, all sorts of things like that. So this isn't just willy-nilly. This was really well thought out, and I appreciate your work on it. And probably good for you and I to thank the chairs of some of the committees too, right? Like the Aging Committee, Public Health Committee, Human Services Committee. People came together, did a lot of work on this stuff. So then there's that NALOG answer.
The NALOG bill, yes, the 1030.
Senate Bill 1030, an act concerning long-term care facilities. It's got a lot to it, and I will note all of these are on AARP's website, so you can read about them there without having to go search them out. You want to talk about that one?
Certainly. I'm going to say for the rest of my life, the number 1030 is going to be burned in my brain and really associated with that period of time. And I will concur with you and say that without the leadership of the chairs of Aging, Human Services, and Public Health, we would not have made these gains this year. So definitely a huge thank you to them, and the fact that we're already looking at what's next to come and keeping this energy going. So 1030. So 1030 came out of these work groups that we had in NALOG, the oversight work group got together, and we kind of broke down sections of care, right? Let's talk physical plant, infection control, visitation, all of those different areas, and looked at what were the most important things that were impacting people, and where did we need to see change, and what was that change going to have to look like to propel things forward. And so they put together 1030, and out of it, when it was passed, there were some things that changed over time, but it really addresses those infection control issues. The requirement for nursing homes to have PPE, right? Everybody knows about PPE now, that personal protective equipment. The ability to improve emergency planning in these long-term care settings. And huge for me was addressing the social and emotional and mental health needs of residents in conjunction. I think, again, you can't have one without the other. With the medical, you need to have the social and emotional. Also, huge change here in Connecticut, a change from 1.9 hours a day of hands-on care as a requirement up to 3 hours a day of hands-on care per person. I'm hoping that that's going to really be felt by the residents and how they see their day go. And we know that staffing has been a challenge here. I'm hoping that as we've been able to see the increase in wages and staffing here in our state, that more people will go into this area of dedicated work and see it as a career ladder and really embrace the idea of working in long-term care communities so that we can have an even more enhanced system.
Yeah, I'm glad you brought up the workforce issue. This is going to be a major focal point, I think, for the state moving forward, for both in working in a facility and working in home care. You know, it's got to be a career that people can advance in, so that people stay and there's quality people. This is, you know, taking care of some of the most vulnerable people in our lives, and we're going to have to put some effort into that. So, yeah, there's been really impressive work done. AARP produces a monthly nursing home dashboard regarding COVID, and we've been doing that for several months. And it'll be updated monthly with the data. You know, hopefully people can check that out for anywhere in the country, which is the nice thing. So if you're sitting here in Connecticut and you've got a loved one in a nursing home in New York, you can see that data there too. Sort of a one-stop shop with a nice map, and you can charts and graphs and all those things. So, Mairead, as you look back, you know, what kind of lessons have you? What do you think you've learned? What have you thought, like, let me take away from this? You know, not necessarily even in preparing for this again, but just, you know, whatever you think. I can't. Your life was such a whirlwind for so long. You probably have barely even had time to think. But I'll ask you anyway.
True. I think looking back, there's a few things that stand out, and one that I learned, that the use of technology, these types of meetings, doing things virtually and getting information to people in a way that they can listen to it when they want, they connect, they can easily shoot me a message and have me answer it, doing the Facebook Lives, that was huge. I never would have done that if we weren't in this situation, to be honest with you. And starting the podcast, trust me, I wouldn't have done that either. But as we hear from more people that that's the way they're getting information and that's the way they want to receive it, I do think that that is a major lesson learned. I hope that we've learned, and we're kind of seeing that through the ability to have the virtual testimony, that we don't ever again decide for a large body of people that we know best, and that we're going to put sweeping guidance in place that has such a significant impact to them. And although here in Connecticut, I feel very fortunate that we have some amazing long-term care communities in our state, and we are very fortunate. But a lot of the concerns, no matter how good you are, there's always some concerns that come up. There's things that need to be addressed by family that we'll see that the building might not see, right? I've worked in long-term care communities when I was younger. You walk by the same thing every day. You don't see it the same way as a fresh set of eyes. And one of the lessons I think we've learned is by not having my team in regularly and DPH, there were things that we're now seeing, and you're almost playing catch up because people haven't been in the building for that long period of time and the staff were just in crisis mode, that now there's a lot that needs to be addressed. There's some fine tuning. And for the homes that struggled, we're seeing even more of that. So I don't think there should ever be a time where regular access for surveys and ombudsman visits happen, as well as the need for essential caregivers. I just really want to put a plug in for that. It's a federal bill, Bill 3733. There's a reason why they're called essential caregivers. Whether they're doing hands-on care, meeting emotional needs, they're there and they see things and they're able to help advocate for the individuals that they are there to be with. And that gap, that's where we receive a lot of our complaints. I think people are at a higher risk of abuse and neglect. And that's hard for people to hear. And a lot of times people in the industry say, well, how can you say we're abusing people? And I'm not saying that. I'm saying that for individuals to have the right to have that private conversation, to talk about how they felt about something that happened, to have someone help them bring that forward, that was missing. And that's a component of that that puts them at higher risk. So I don't want to ever see that happen again. And I'm really hoping we can get, the support from everybody, because essential caregivers is something everybody can, no matter where you live, what community, everyone can benefit from. You're on mute.
You knew it would happen at some point, as I try not to let the lawnmower noise in the background come through. Okay, I guess I would ask you this. Parting words. What's the best advice you have for individuals and families who are considering long-term care options? Where do you go to look? How do you know what you need to know to make an informed decision?
On CMS, there's a compare site where you can compare long-term care facilities in your state. It's non-biased. It has to do with surveys. My only caution there is that there haven't been surveys actively being done for a matter of 18 months now, and they are getting out and they're trying to do those, but that data is going to lag. So that might not be the present situation in those homes. We really recommend that people go to the different settings, ask to talk to the resident council president, look, see the feel of it. Sometimes the shiny, prettiest one isn't the best one for you, and that you really get educated on what all of your settings are. Nursing homes are a very viable setting for individuals, but so are many different levels of care, as well as the home care program for elders in the community. So many people don't think that that's accessible to them or understand under waivers what really is capable of being done in those settings and the use of technology. So I would really encourage people to have a universal assessment done, find out what all of their options are, and then make a truly educated decision about what is the best option for them.
And I'll give a positive look ahead here, in that with all the bad things that happened with COVID, you know, some good things happened, like the federal government sent states money where they can get extra matching dollars for improvements in home care, among many other things related to nursing homes. But I think there's going to be in the next few years some really interesting programs happening. I think people are going to find this an easier system to navigate. And I think that technology and helping keep people at home via team approach that even includes a handyman, for instance, is going to move us to a place where we even further rebalance our home versus group settings in a way that makes everybody's life easier, and that they'll have more choices, more information, and more of an ability to say, this is what I want and this is how I want it, and get it that way. So that's a positive thing. All right, Mairead, I thank you for being with us today. Again, thanks to you and your team. And I'll also give a shout out to all the families that, I've met along the way on your Facebook Lives and through some of the advocacy groups that they formed. They have been a tremendous voice in making sure that, they helped with all this legislation, and that their real people voices were at the table. Nobody cares what a lobbyist says, so, and you there as the person, the voice of those nursing home residents and staff has been tremendous. So thank you again. And we'll see you guys next time on Coffee and Tea with AARP Connecticut.